And the new ones are Bharatiya Nyaya Sanhita, Bharatiya Nyaya Sanhita, and Bharatiya Sakshya Adhiniyam, who were killing people on the roads, also were being equated with doctors operating and having some complication on the table. So the relief which was given was, though the punishment for 304A, now under section 106 subsection 1, had been increased from 2 years imprisonment to 5 years. The person who's receiving the complaint, maybe the sub inspector, maybe whosoever is sitting at the police station, for him to decide what sections are to be applied. Rightly. And the topic I have chosen is, will medical profession survive BNS 2023? I have my doubts, and let's see why I do have my doubts. Um, that you don't know the law is no excuse in court. When you're defending yourself, you cannot say, "Sir, I did not know this." That is no excuse, and any act of yours, if deemed to be criminal activity, would be punished therein. We have three new criminal laws. The old ones, the Indian Penal Code, has been repealed. The Criminal Procedure Code, the CPC, this has been repealed, and Indian Evidence Act has been repealed. And the new ones are Bharatiya Nyaya Sanhita, Bharatiya Nyaya Sanhita, and Bharatiya Sakshya Adhiniyam. These are basically the three new acts. And what is important is that in Indian Penal Code, there was nothing like the word medical practitioner, medical negligence, negligence by a medical practitioner while doing a medical procedure. None of these was mentioned in Indian Penal Code. In fact, Indian Penal Code had specific sections by which doctors could claim immunity from criminal prosecution. Even in BNS or BNSs, as such, the term medical negligence has not been mentioned. In fact, Mr. Amit Shah, when he was introducing this in the parliament, had specifically said that we will not include the healthcare services, healthcare practitioners within the purview of criminal negligence. However, when the final bill became an act, we realized that the only relief which was given was that otherwise in section 304A, which was now section 106 subsection 1, the punishment which was meant for causing death by negligence, mainly which was applying to truck drivers and drunk drivers who were killing people on the roads, also were being equated with doctors operating and having some complication on the table. So the relief which was given was, though the punishment for 304A, now under section 106 subsection 1, had been increased from 2 years imprisonment to 5 years for everything else except for negligent act done by a medical practitioner while performing a medical procedure. So medical negligence in this way has been introduced as one of the criminal actions like rape, like theft, like extortion, like kidnapping. All these are criminal actions. And now, by defining that a negligent act done by a medical practitioner while performing a medical procedure within one of the sections in BNS, it is now accepted that medical negligence is a crime, and it now becomes up to the person who's receiving the complaint, maybe the sub inspector, maybe whosoever is sitting at the police station, for him to decide what sections are to be applied. Many people argue earlier also with me that medical negligence was only for section 304A. I'll show you that it was never meant only for 304A, and all other subsections and sections. Doctors had been prosecuted even under section 302, which was murder. Doctors had been prosecuted under that. Now, one thing more which was mentioned in BNS section 106 subsection 1 was they defined the term medical practitioner. And medical practitioner was defined as a person who's registered in State Medical Council or National Medical Council. It was like saying that only thieves who were registered with the government as thieves would be punished for committing theft. There are medical practitioners of umpteen types in India. But criminal action, criminal negligence would be considered only in cases of those doctors who were registered under National Medical Commission or State Medical Commission. So my question is, if a BMS doctor, a BHMS doctor, a BUMS doctor, an RMP does something, and which is a criminal action, which is criminal negligence per se, would that be outside the purview of BNS? Would that not be prosecuted as criminal negligence under BNS? And second thing, they have mentioned negligent act done by medical practitioner while performing a medical procedure. So if I'm not performing a procedure, but have not seen a patient for 4 hours, and for that the patient has gone and filed a complaint against me, would that not be considered within criminal negligence purview? Because I haven't performed a procedure. Look at Kunal Saha's case. What procedure was performed by Dr. Sukumar Mukherjee? Nothing. No procedure was performed. But a criminal case was filed against Dr. Sukumar Mukherjee. So my question is, I can give you umpteen examples. Christian Medical College, Vellore. Hormone replacement therapy was started on a patient. The patient says, I was not told that hormone replacement therapy can cause infiltrating duct carcinoma breast. And because of this, a criminal case was filed against the Hero Department of Obstetrics and Gynae, against the medical superintendent of Christian Medical College, and relief was not granted even by the High Court. So my point is, cases where a medical procedure has not been performed within BNS, because this is a new act, I need clarification whether cases of alleged criminal negligence would be accepted if no medical procedure has been performed, but doctors have been still dragged to, have been alleged to have committed professional negligence. Let us look at the civil and criminal liability. Jacob Matthew judgment in 2005. This was Dr. Jacob Matthew versus State of Punjab. A case from CMC Ludhiana, in fact. And they brought the term gross. This and Dr. Suresh Gupta versus NCT of Delhi, two judgments from Supreme Court, basically brought out the term gross. And they said that simple negligence cannot be prosecuted under criminal law. It was only cases of gross negligence which could be prosecuted under criminal law. All doctors celebrated, every advocate, every Supreme Court judges, High Court judges I have interacted with, everybody said this is a very good relief for doctors. I'm not so sure. Because prior to this, There was no ground. In fact, IPC was very clear in giving 4 or 5 sections within IPC which would protect doctors for having done their act in good faith, whether with consent, without consent, did not matter. And all doctors do their, uh, they participate in the profession, they do medical procedures. Everything what is done by a doctor for a patient is in good faith. So this was given a protection within IPC, but unfortunately in 2004 and 5 in these two judgments, the Supreme Court thought it fit to make an exception and that some cases would fall within the purview of criminal negligence. The problem is, what is the definition of gross? It is such a subjective term. Some people say that operating on the wrong side, or supposing left leg has to be amputated and you have amputated the right leg, this would be considered gross negligence. But if you go back to VP Shanta and others' judgment 1995, this was the example which was given to include medical profession within the purview of Consumer Protection Act, which was summary jurisdiction under civil law. So if operating on the different on the wrong side is civil negligence, then it cannot be criminal negligence, because the bar for criminal negligence is much higher than that for civil negligence. So my question is, what is the definition of gross? Everybody who's adjudicating, whoever is sitting on the bench, whether it is a high court judge, whether it is a judicial magistrate first class, or a sessions judge, it is subjective. What may be gross for one may not be gross for another. And I'm giving you classical example where 3-judge bench from Supreme Court has held outright cases of giving an injection into the artery instead of vein. These are cases which normally doctors would say are outright cases of negligence. But then the court has very clearly specified these as falling within the purview of civil law, consumer courts, not even civil courts. So this is something which bothers me, because this subjectivity creates a situation which is exploited by those who file cases against doctors and the law and order machinery to extort doctors. Once you get a complaint in a police station against a doctor, I mean, they're very happy. It simply means they can extort the doctor, they can arm twist the doctor into coughing up money both for the police as well as for the complainant. Actually, under law, for an act to amount criminal negligence, the degree of negligence should be much higher. And there should be an element of recklessness and total disregard of known hazard. All this is necessary to classify negligence as criminal negligence. Unfortunately, as I mentioned earlier, there is no definition of the term gross and this overlap between. And the problem is, how does a criminal prosecution start? A complaint is made to the police writes to the civil surgeon forms a committee, or some doctors from the government hospitals, they may form a board, they give an opinion ki yes, there is negligence or no negligence. The problem is, it is such a complicated matter whether a particular action of omission or commission by a doctor is civil negligence or criminal negligence. Even the highest level judiciary will not give uniform answers in same facts, same complainants. Leaving this thing open is extremely problematic. And I always say this, that it is the judicial process which is the punishment for doctors, not actually the final punishment. Because a case which drags on for 15 years in courts The humiliation which a doctor faces for 15 years, going repeatedly to courts, being asked all kinds of questions, stupid questions in court by people who have no understanding of what medical principles are. A punishment of maybe suspension of license or 5 lakh rupees fine or maybe whatever, that punishment does not matter as much as the humiliation the person undergoes in the judicial process. So if there is no clarity between the difference between civil law and criminal law, it creates a lacuna which is exploited by those who will use this to benefit themselves. Even the medical boards have no idea, the doctors who sit on medical boards in civil hospitals, and they have no idea of the difference between civil and criminal law. From their side, a simple statement that yes, this could be considered negligence because they did not explain or they did not convey the problems or the complications to the patient relatives. The word negligence, if is used in the report, automatically the police is going to assume that they are talking of criminal negligence, whereas they are not. Even if you have taken consent or not taken consent, it does not fall within the purview of criminal negligence. And there is a fundamental principle in criminal law that any crime consists of both a mental as well as a physical element. And mens rea is the term which is used, which is a person's awareness of the fact that his or her conduct is criminal. This is the mental element, and actus reus, which is the act itself. So you have taken a knife and you have gone and killed another person. You had an intention to do that and then you went and did it. This is mens rea. The action itself, which may be in defending yourself, that is actus rea. And as I already mentioned, reckless disregard for human life and well being also constitutes mens rea. Because doctors have always argued in court that we did not have any intention to kill the patient. True. But courts have said that if you are showing a reckless disregard for human life and well being, that in itself is mens rea. Now comes the question, what is recklessness? Doing something, there comes a stage when a normal person would realize the disastrous consequences of his action. And despite that realization, if he still persists in his course of action, then he is reckless. Again, a very subjective situation. You have taken up a patient for surgery, you have taken up a patient for delivery. During the procedure, you realize the lie of the child is not cephalic. Let us say it is transverse lie, or there is a shoulder dystocia, or whatever. Now, do you have this much time to change your course of action? The law is, I say, an ass if it does not realize that doctors do not have the discretion of years and decades to take a decision. We have to take decisions within minutes, and the consequences of our decisions will be evident within minutes. You cannot refer to old cases, you do not have time for all that. So if this and this could be interpreted as knowing fully well that there is shoulder dystocia, still you persisted with conducting the delivery and caused, let's say, palsy of the hand. The hand is paralyzed now. This would be construed as criminal negligence by some. But what option did the doctor have? Could he immediately at that moment have converted the whole thing into a cesarean? If we do cesareans for these kind of indications or to prevent these kind of problems from happening, even that is considered unethical. So, this is something which needs to be understood by society, and the moral culpability of recklessness is not a desire to cause harm. So, the issue, the law which has taken an excuse that doctors' actions do not construe mens rea, they do not have an intention to harm, they have interpreted it as recklessness in doing something is also equivalent to mens rea. And hence, a doctor's actions would be covered within purview of criminal law. So, what is the cognizable offense? Cognizable offense means an offense for which a police officer may arrest you without a warrant. Why I am bringing this? We have all been harping about Jacob Matthew judgment. We have what we have forgotten is there is also another judgment from Lalita Kumari versus State of UP, which has said clearly that an FIR has to be lodged if there is a complaint. Certain exceptions have been made. Medical negligence is one of the exceptions. And this is a 5-judge constitutional bench. It is not a 3-judge bench which had given the Jacob Matthew judgment. And they have said very clearly that to investigate, the police will have a period of 1 week. The problem is, all this has been said and stated keeping Section 304A in mind. Section 304A was punishment up to 2 years. Now, there the police person has the option of giving bail on his own. But now, sections the what has happened in new BNS is the overall punishment has been increased for different sections. I will come to that part. And if you are talking of prosecuting a doctor under section 117, let us say you have given IV fluids, there has been a swelling, there has been a discoloration, there has been a compartment syndrome, there has been a gangrene, and 2 fingers of the child have to be amputated. Now, this is not section 304A or section 106 subsection 1 because the child has not died. So, this is not death causing death due to negligence. What is this? This is grievous injury. Now, grievous injury comes under section 117, and the punishment there is more than 7 years. If the punishment is more than 7 years, then the police official does not even need a warrant. So he does not need an order from the magistrate. He can arrest you straight away. This is something which my fear is will be misused against doctors in coming years. What is a culpable homicide? If you have caused death by doing an act with the intention of causing death, or with the intention or knowledge of causing such body injury as is likely to cause death. Now, this is my major issue with the law of criminal negligence. All doctors who are qualified, all doctors who are specialists, super specialists, they are given the knowledge that while doing an LP, you can cause a coning, that while doing an intubation, you can cause an arrest, that while doing a PR examination, person may go into cardiac arrest. My knowledge is what is considered crime because they say you had knowledge that what you had done could cause death. Hence, this is culpable homicide. I find this very strange. Effectively, law wants us to be uneducated, illiterate, not having the knowledge of what harm can be caused by the medical procedure or the medicine or whatever it is that we are doing to try to help the patient. How can knowledge be a crime? This is the most unfortunate part of criminal law. Then there are certain bailable offenses, certain compoundable offenses. Compoundable offenses in criminal law where the victim and accused can resolve their dispute through settlement, bailable where bail can be granted during arrest or during trial process, and certain non-bailable offenses. Even BNS is not very different from IPC in giving protection to, I will say, doctors. Though these sections have never been used or never been litigated, but these sections were always there. What was Section 80 IPC? Nothing is an offense which is done by accident or misfortune and without any criminal intention or knowledge in doing a lawful act in a lawful manner by lawful means and with proper care and caution. Now, a gynecologist doing an MTP or a DNC causes perforation of the uterus. Was she doing a lawful act? MTP Act allows it. Was she doing in a lawful manner? Her center was recognized, she was recognized for MTP under law. By lawful means, whatever procedures were supposed to be followed, consent had been taken, everything had been taken. But the uterus was perforated. This is clearly given as an exception that no criminal prosecution of the person can be done for doing something like this. This was in IPC section 80 and now in section 18 of Bharatiya Nyaya Sanhita. Section 19 BNS. Nothing is an offense merely for reason of being done with knowledge that it is likely to cause harm. On one side, you are saying having the knowledge that whatever you are doing is can cause harm is not an offense. On the other side, for culpable homicide, in definition only you are saying if you have knowledge that your action can cause death and you have gone ahead and done the action, then under those circumstances it is culpable homicide. Law is, I have no words for it. If those who have drafted these laws, uh, I don't know. I cannot praise them enough. I mean, that's my only thing I can say about them. Section 25 BNS, Section 87, 88, 89, 92 of IPC, 25, 26, 27, 30 of BNS. Harm caused by an act done in good faith without consent if the person is not in a position to give consent. There is no consent. You have done a surgery in the interest of the patient dies. It is a protection had been given to you in IPC as well as BNS. But does a doctor ever be protected by these? These are sections which are the forgotten sections in IPC, forgotten sections in BNS. With the police officials look at only those sections under which they can prosecute. And if you look at what is the definition of good faith, there is something called General Clauses Act. And the clause 22 in this act says that a thing shall be deemed to have been done in good faith, where it is done honestly, even though it may have been done negligently. So if I am honest, if what I am doing, I am clear about it, I am honest about it, that I am doing for the benefit of my patient. Even if I was negligent, I cannot be held prosecuted for criminal negligence. Duly qualified, licensed, and competent doctor providing treatment to the patient with his consent to the best of his ability, even if it was negligent during treatment, he cannot be denied the protection of good faith due to his honesty. So let's come to the basis 304A, which is the classical section under which doctors were being prosecuted earlier. And now in BNS, it is section 106, subsection 1. So the only benefit we have got here is If this action is being done by a doctor while doing a medical procedure, the imprisonment is 2 years, not 5 years, as has been provided for others who cause death due to negligence. The only thing is, there used to be earlier in 302, 304A that it could be imprisonment up till 2 years or fine or both. So it was up to the judge to decide whether to impose a fine on the doctor or to impose punishment plus fine or to impose imprisonment only. Now it is imprisonment of 2 years, up to 2 years with fine. The fine and imprisonment both have to be now awarded. And as I mentioned earlier, it is only for doctors of modern scientific medicine that this prosecution will be there. Look at section 100. Whoever causes death with intention of causing death or with knowledge that he is likely by his act to cause death. As I mentioned earlier, this knowledge is considered the crime when deciding whether the person has done culpable homicide. This is something which we should have not allowed to happen, but has happened already, and we have not protested enough. Medico's Legal Action Group has, of course, pleaded in Madras High Court uh, in a case which has been filed by DMK against BNS being unconstitutional. So we have also given our application to be implemented in that case, so that because we feel that for medical profession, Bharatiya Nyaya Sanhita is going to be disastrous, and we have applied for impleadment to be heard and our arguments to be heard in that matter. I don't know what is going to happen there, but anyway, we will make our attempt. 103, murder. 105, culpable of homicide not amounting to murder. Imprisonment here is 5 to 10 years, and also shall be liable to fine if the act has been done with knowledge that it is likely to cause death. Otherwise, culpable homicide, the punishment can be up to life. But if you have done an action which is considered culpable homicide because you had knowledge, then it is only 5 to 10 years. So expect these clauses, these sections to be applied on medical professionals also. Grievous hurt. These used to be sections 336, 337, 338 in Indian Penal Code earlier. What was this? Whoever voluntarily causes grievous hurt with intention or knows act is likely to cause grievous hurt. Punishable with imprisonment up to 7 years plus fine. Whoever causes any permanent disability or persistent vegetative state shall be punished with rigorous imprisonment for 10 years, but which may extend to imprisonment for life. Now tell me one thing. There is a situation where you have taken up a patient for fracture reduction, for cesarean section, for XYZ cholecystectomy, and on giving anesthesia, the patient develops cardiac arrest. Would you or would you not resuscitate this patient? Would you do cardiac massage? Would you give oxygen, artificial respiration, intubation, intracardiac drugs, or would you not? Why am I asking this question? You think it is a very stupid question to ask. No, it's not. Because if I am accused by my act of omission or commission that I have been so negligent as to cause death, the punishment for me is 2 years. We have already seen section 106 subsection 1. But if I do the cardiac resuscitation and the person comes out after 15 minutes, his heart stabilizes, his respiration stabilizes, but he is no longer conscious. And he has hypoxic brain injury. Later on, which is found to be he is in a permanent vegetative state. So, for doing my job correctly and resuscitating the patient who had gone into cardiac arrest for whatever reason, I will be punished for imprisonment with imprisonment from 10 years to life imprisonment. And if I let him die, I am going to be punished with imprisonment only up to 2 years. So I am in a dilemma. I wish all these people who pontificate on us, who wish to sit in judgment on us, are the ones who actually face the problem when they arrest and doctors sit and decide that it is better to let the person die rather than to resuscitate and take the risk of life imprisonment, how it is to be on the other side. This is something I have tried to give representations. I have failed to make people understand. I have failed to make politicians understand, judiciary understand. This is going to cause disasters. What are you doing? Who in his right mind has made these laws? If I have done something, if a person operates and on the eye and the patient loses his eye, now this is permanent disability. Punishment, rigorous imprisonment for 10 years or life imprisonment, right? But if I operate on the eye and realize I have messed up the eye, it is better for me to kill the person so that the punishment is only 2 years. It is ridiculous. Whoever has thought out these, you look at the what is grievous injury, and the examples given are emasculation, permanent privation or of sight of either eye, hearing, privation of any member or joint, destruction, permanent impairment, grievous injuries. They have given a complete classification of what all is considered grievous injury. My point is, punishment for causing grievous injury is more than punishment for causing death for doctors. And when I'm talking of vegetative state, it means person has gone into cardiac arrest. He has got CPR, which is cardiopulmonary resuscitation done. And when he has revived, by that time there is already hypoxic brain injury. Now tell me this thing, how many cases of cardiopulmonary resuscitation in India occur outside the hospital settings? It occurs only within hospitals. This concept of emergency medical personnel coming in very fancy ambulances and attending to roadside victims is not there in India. In India, all cases of cardiopulmonary resuscitation will be done in hospitals, in ICUs, in OTs, and in majority of these people, you will be able to save them. You will be able to bring them back without causing hypoxic brain injury. But there will be some patients who will develop hypoxic injury. Look at the dilemma you are putting the doctor into. You say a sword should not be hanging on head of the doctor. I say there is no bigger sword. You have not only created a sword, you have also created such a huge mountain under which doctors and medical practitioners will be crushed. Look at what is section 118, voluntarily causing hurt by means of any instrument. Now, when you say any instrument for stabbing, cutting, which is likely to cause death, or by any substance which is deleterious to human body to inhale, swallow, or receive into the blood, how will a person receive into the blood? Mostly by a doctor or in a hospital. How will a person be injured by cutting? I mean, anybody interpreting this, a doctor who's doing a surgery is cutting. And punishment is for 3 years. Whoever causes grievous hurt will be punished with imprisonment for life. And if you have done it with knowledge, you have not done it with an intention, but with knowledge that you could cause problem, but still you have gone ahead, then it will be 10 years. So I fail to understand what is the logic behind this. You have a grudge against modern scientific medicine. You say so. Stop all the MBBS colleges. Let us have only BMSs. Let us have only RMPs. Why keeping on increasing MBBS courses? Why keep on increasing super specialty courses? Uh, this is if this is all the if this gives me any intention, I mean, you want to simply produce doctors of modern scientific medicine so that you produce them, you take the fees from them in crores, and then you send them abroad. Let's do it that way. Then, whoever voluntarily causes hurt on grave sudden provocation, but neither intends nor knows to be likely to cause hurt to any person other than the person who gave provocation, shall be punished with imprisonment of up to 1 month. Now, the question is, in a hospital setting, somebody's relative has died. Is this provocation? And is the violence, is the grievous injury which the patient's relative causes on the doctor to be considered having been given on provocation? Because that would be a very good defense. Then, section 124. Again, vegetative state wherever comes in, whether it is because of acid or because of the thing is in the definition, this was basically meant for acid attack victims because the criminal law amendment act 2013, which had come in, basically had said that cases of acid attack victims and rape victims, there was a special law which was formulated because they had said IPC is not sufficiently tackling this. The same thing now has been incorporated in section 124. So the idea was for burns and rape victims. But then they come with or using any other means in part of the definition. When you say by using any other means, with intention of causing or with knowledge that he is likely to cause injury or hurt, or causes a person to be in permanent vegetative state, shall be punished with imprisonment of either description for a term which shall not be less than 10 years. Again, vegetative state by any other means, not necessarily acid. What do you mean by this? Problem again will fall mainly on doctors. So, as I mentioned, if person goes into sudden cardiac arrest and let us say in high court one of the justices sitting on the bench has a sudden cardiac arrest and the doctor who's posted in high court goes and resuscitates, he revives the judge, but there is hypoxic brain injury. Patient goes into a vegetative state. He will be having rigorous imprisonment for 10 years to life. If he does not resuscitate and causes death, it will be simple imprisonment for 2 years only. So, my point is, all this needed much more discussion, much more much more in-depth analysis, much more discussion with stakeholders before these kind of laws should have been brought in. But unfortunately, our lawmakers think they know everything. Our judiciary thinks they are God's gift to humanity. And society somehow has been brainwashed into thinking that the only criminals in India are the doctors of modern scientific medicine. Everything else, what is happening to them, is because of their fault. When you do a rash and negligent act endangering human life or personal safety of others, even for this, you can be hauled. So basically, these are all the sections which will be used against doctors. Now, you have done an endotracheal intubation, a pleural tap, you have put in a CVP line. Uh, Anybody can say you have done it rashly and negligently, endangering human life and personal safety of others, so you should be punished. The terminology is such because in one section, the medical practitioner and his act while doing a medical procedure has been considered as criminal negligence, it automatically extrapolates that this is going to extend to other situations also. Section 304, 304A, umpteen number of cases we had under which doctors had been prosecuted. On panel discussions with senior judges, with senior police officials, I did not find a clarity of thought, a clarity on Jacob Matthew guidelines. Some people argued with me that it is only cases under 304A that cannot be filed. Under other sections, this requirement is not there of making a board or taking opinion from a government doctor before filing an FIR. One gentleman tells me FIR under 304A can be lodged, but doctor cannot be arrested. अरे 304A में तुम्हें अरेस्ट करने की जरूरत ही नहीं है, तुम करो भी तो साथ ही साथ तुम बेल दे सकते हो. Court orders keep changing. CRPC is my Bible and it does not mention any such procedure. This is also the reply given to me by an ADGP of one state in India. FIR was lodged, doctor arrested only to pacify situation. And best is medical board's opinion may be taken by investigating officer before proceeding, not shall. And hence this is not mandatory. This is also the opinion of a DGP of one of the states where I was giving a talk and he was also on the panel. So under RTI, Medicos Legal Action Group, which basically I represent, we had asked Punjab and Haryana, entire police stations, that how many cases of medical negligence have you filed against doctors in past 5 years? They said we have filed 74 cases. So then we had also asked a second question: in how many cases had you taken a medical board's opinion before filing these cases? So they had taken opinion only in 4 cases out of 74 cases which were filed. So we filed a writ petition in this regard in Punjab and Haryana High Court. And Government of Punjab and Government of Haryana issued orders after our PIL. And these orders were also filed as part of reply. After these orders were passed, it took 10 years for the court to finally give a judgment that yes, the police cannot proceed without taking a medical board's opinion as per Jacob Matthew guidelines. I mean, it was something which was straightforward, which was obvious, but obviously our methodical high courts, they need time of up to 10 years to decide that yes, Jacob Matthew judgment was given by the Supreme Court and we should follow the orders given there. Can't help it. Despite this, in BNS came in recently 2024, and in November 2024, we had this case where under section 105, this was culpable homicide, the doctor was booked. And why? Because he had knowledge that by his act he could cause death. I wish my teachers had not taught me that my actions in trying to save the patient could also cause harm. So best is for our lawmakers to be treated by doctors who are not knowledgeable, preferably not educated, because they probably will form the best doctors. Under RTI, we went and asked all police personnel, police officials, all DGPs across India. Because I had repeatedly been told this by various senior people on panel discussions and otherwise debates, that criminal negligence against medical practitioners is limited to 304A. I have two cases where 302, which was murder charges, were given. One was Dr. Archana Sharma, other was Dr. Archana Massey. Both of them had patients who had postpartum hemorrhage and died. And one of the doctors committed suicide after that. The other doctor, also named Archana Massey, she had to fight her case and the problems faced. Section 304 has been frequently applied, subsection 304, subsection 2, not 304A. 304A is routine, but 304 also has been applied, which is culpable homicide. Now I ask them, you forget 302, 304A, 304. You tell me under section 336, 337, 338, 351, 420, basically other sections of Indian Penal Code where doctors have been accused of causing grievous injury or cheating or something else, not 304A. So, from all across the country, we got information, and if you look here, there are four cases which were filed in this reply. There was one case in this reply. This was, I think, from Karnataka state. Karnataka state, these were the number of cases. They gave year wise details of cases which were filed against doctors, not under section 304, 304A. And here I am showing you uh, cases which were repeatedly quashed by high courts and Supreme Court uh, under section 304. That was culpable homicide. But police does not stop in filing cases in section 304, and now with medical procedure, medical practitioner, these terms having been incorporated in section 106 subsection 1 of BNS, we are going to face this more and more, and it will not be restricted only to culpable homicide. It will come to grievous injury and vegetative state and everything which I have mentioned earlier. In case you wish for me to stop here and take questions, I will do that. Otherwise, let me know how to proceed because I see the time is limited. Batsha?
So, yeah. So before that, I would like to ask our doctors if they would like you to proceed. So, doctors, you can send in your response in the comment box or via the emojis if you wish, sir, to proceed with the lecture.
No, in case there are any questions, I'll take the questions now. Otherwise, I'll carry on.
Yeah, I think doctors want you to proceed, sir, based on the comment.
So, lot of things we hear that patient was not allowed to go home because hospital bill was not cleared. So, wrongful confinement is a problem, and wrongful confinement by a hospital would also result in criminal prosecution. If somebody uses violence against doctors, these are the sections which can be used to prosecute them. Remember, whoever being in charge of a hospital, public or private, whether run by central government or state government, contravenes provisions of section 397 of BNSS, that is Criminal Procedure Code, shall be punished with imprisonment for a term which may extend to 1 year or with fine or both. Now, what is section 397? 397 is basically what Criminal Law Amendment Act of 2013 had said, that all hospitals, public or private, whether run by central government or state government, shall immediately provide first aid or medical treatment free of cost to victims of rape, acid attack, or for sexual assault in children under POSCO Act, and shall immediately inform the police of such incidents. Acid attack victims, the treatment cost is not reimbursable. There is no mention of how the cost is to be recovered, but this is now statutory requirement that private or public, any of these cases coming in, you have to treat, and cost is not an issue. Then lot of issue of fabricating medical records. Doctors occasionally have come to me with files and said, "Ki consent is not complete," or shall I now add things here, or whatever. The thing is, if you alter or fabricate or tamper with medical records, this will get you into a bigger problem, because today everybody has a smartphone. And if somebody has a copy of your medical records and it can be shown that you have tampered with medical records, you will be looking at imprisonment of up to 7 years, with or without fine. Then, Section 239 is if you know or have reason to believe that an offense has been committed intentionally and you omit to give any information respecting the offense which you are legally bound to give, you shall be punished with imprisonment for a term which may extend to 6 months or with a fine or both. Now you have a pregnancy in a lady who's brought to you and for delivery, and the lady is 18 years, 8 months, and 29 days, which means the child was conceived when the patient was not a major. Now, this kind of situation, the patient's, the wife's parents are also there, the wife's so called husband or the boyfriend is also there, and by law, you are supposed to give information to the police. You land up into a problem otherwise. Similarly, especially gynecologists see a lot of this. There is they know very well that there has been domestic violence, and the female who has come to them is badly beaten up. Should they be reporting this to police? Because it is very easy to say that if you do not give this information, we will punish you. But for doctors who are acting as counselors also, uh, we land up into many tricky situations uh, in our routine medical practice, and all of them are not cut and dried, straightforward answers. Then the issue is whoever fraudulently or dishonestly, with intent to injure or annoy any person, makes in a court any claim which he knows to be false, shall be punished with imprisonment of either description for a term which may extend to 2 years, and shall also be liable to fine. Now, the question is Consumer Protection Act 2019 has excluded any penalty for frivolous complaint. So, my thought here is, would it be possible for us to use Section 346 of BNS and prosecute such patients who make false claims and file frivolous cases in courts, but then whether Consumer Protection Act commissions would be regarded as courts would then again become a dispute. They are quasi judicial fora, yes, but would they be categorized as courts is something which will need to be seen as time passes. Unlawfully or negligently act likely to spread infection of any disease, malignantly does any act likely to spread of infection. All these cases which we have of hospital acquired infections would also be dragged into these sections later. Now, we have various sections and many cases where you have made a diagnosis, the carcinoembryonic antigen levels or the ovarian tumor markers, these are high. Ultrasound shows there is a mass in the ovary. You have gone ahead, operated, and uh, finally the histopath report has come as non malignant. Now, had you, because you have based your decision on the ultrasound, on the CT scan, and on the tumor marker, which is CA125. And the impression you got was that this mass could be malignant, and you have conveyed this impression to the patient. But after surgery, the whole thing comes out to be benign. Look at the sections under which you will be prosecuted. That you have committed extortion because you have put a fear of injury or death in a patient's mind, and the imprisonment can be 7 years, 2 years, 10 years. So, my point is, these are not issues because we are caught anyway. If in every patient we decide first to take a tissue diagnosis before doing any surgery, on one side we are told you cannot perform any procedure unless and until you have told exactly what the procedure is, what are the side effects, what are the complications, what are the risks of not doing the procedure. On the other side, if you have told all this, and even that, what is the cost of the procedure? And on the other side, if you have told all this and it does not turn out finally to be what you suspected, you could be uh, hauled to courts for dishonesty, for extortion, for all these kind of things. So I think we have crossed our time. Uh, Barsha, in case there is any question, I will take it, or I think we'll need to stop here.
Uh, yeah. So we have quite some questions coming in from our doctors. So maybe we can get with the Q&A, sir.
Okay.
Yeah. So you can stop screen sharing so that I can highlight the question on the screen for everyone.
How do I stop the screen share?
So on the laptop, you can just open Google Chrome and click on stop sharing.
Okay.
Stop sharing, yes.
Done.
Yeah. So thank you, sir, for that very interesting talk. And we have quite some questions from our doctors. So we will be getting into that. So taking one of the earlier comments that we had, you can see the question highlighted on the screen, sir. So Dr. Ashok says, treating doctor is the second victim in alleged negligence cases after the patient who is the first victim.
Yes, it is a statement, it is not a question. And he is absolutely right because this is a area we have never worked in. In India, the psychological, the physical, the emotional, the mental trauma a doctor undergoes, um, whether or not the patient files a case or makes a complaint, is something different. But even without that, just because a patient or I lose a patient, it affects me tremendously. And similarly, if I have done everything for a patient, which I think should have been done, and I know I am not at fault, but if I am dragged to courts or if there are newspaper headlines against me or it affects me again. So both sides I get affected tremendously, and there is no support system for doctors, unfortunately, in our country, because this is an aspect which has been neglected, and we will need to step up our efforts where we can provide support to doctors who are victims of this second victim syndrome.
Next is from Dr. Agarwal. Under 1061 BNS, maximum punishment is 5 years imprisonment. Whether it is 7 years under 117 BNS, aren't these two contradictory?
That is death due to negligence. Grievous injury is not considering negligence. Grievous injury is you have taken a sword, you have gone and hit a person, and the person has lost his arm. This is a grievous injury, and for that, the punishment is up to life, 10 years or up to life. And the problem is not here, the problem is the vegetative state. When you talk of vegetative state, they have simply taken up Aruna Shanbag's case, and having that in mind, they have added the vegetative state in the BNS. Because otherwise, the lawmakers have no idea what a vegetative state is. If I ask them what is the difference between coma, vegetative state, and others, they will not be able to answer. But because of this Aruna Shanbag case, the term vegetative state has been included in BNS, and it is going to create a lot of problems. Grievous injury, because don't forget, for if you have killed a person under section 103, it is murder. If you have caused grievous injury to a person, the punishment is less than that for murder. But when you are talking, so it is not contradictory, because here in 106 subsection 1, we are talking of death due to negligence. We are not talking of deliberate killing. Deliberate killing, then you have to compare murder with section 117.
Next, Dr. Nayyar is asking, so what about the other systems of medicine? If you could please clarify.
So क्या बोलूं मैं? There is a daughter-in-law syndrome, and there is daughter syndrome. तो इंडिया में modern scientific medicine doctors are not given the same rights as other citizens of India. We all want, somehow there is a bias towards indigenous medical systems like Ayurveda, Unani, yoga, whatever. But there seems to be some kind of bias against modern scientific medicine. Partly maybe the cost, maybe the issue, partly maybe because we have a tendency to uh, denigrate home remedies which people try, harm themselves, and then come to us. So in a way, something they have been having faith in for a long time, when it is simple thing, dharan. I mean, I cannot get my patient's mind outside the concept of dharan. Whether it is actually gallbladder stones, or it is duodenal ulcer, or it is a gastritis, or it is irritable bowel syndrome, the person will go to a practitioner of dharan and get his dharan lifted. I don't know what happens, because in so many surgeries, thousands of surgeries, maybe 60, 70,000 endoscopies I have done, I have never seen this dharan. But we tend to lose our patience also sometimes in educating our patients who have strong belief in these kind of practices and myths and whatever. So, and as in BNS, as I already said, it is only doctors of modern scientific medicine who will be prosecuted under section 106 subsection 1. Others have not been included here. There's another way to look at it. Others have not been given the relief that doctors of modern scientific medicine have been given. Because if they are prosecuted, probably they'll be prosecuted with the imprisonment of 5 years. Whereas doctors of modern scientific medicine will be prosecuted only for 2 years, will be given imprisonment only for 2 years. So that, I mean, you can argue it that way.
Next, Dr. Kumar is asking, what is the solution to doing medical profession under the shadow of BNS, judiciary, media, MCI, NMW, and unruly antisocial element?
So next 2 decades are going to be very, very bad for medical profession, as I see it. Solution is part of the problem is we ourselves, because all of us seem to think we know the best. If some kind of activity, some kind of action, some kind of process is being followed for resolution of a problem, others find ways to obstruct. Let me give you an example. Consumer Protection Act finally was implemented against doctors in 1995 by the VP Shata and others judgment. I wrote my first book on medical negligence in 1995. Since then, I've been giving talks against it. And I had been told by so many advocates and so many senior people, ki, were you people sleeping? Why did you not appeal this judgment to a higher bench? So in 2019, when new Consumer Protection Act was to come in, they put it in public domain. We gave our representation to modify certain things in CPA 2019. Our suggestions were not accepted, and they went ahead and did whatever exactly they wanted. In 2019, we waited. 2020, we waited. 2021, we waited. In 2022, Medico's Legal Action Group filed a PIL in Bombay High Court on the issue that the legislative intent was not there to include doctors within the purview of CPA 2019. Because now it was not CPA 1986 that had been repealed, and VP Shanta and others' judgment had no court bearing on 2019 CPA. The Chief Justice Bombay High Court, they threatened our advocate that you withdraw this case, otherwise we'll penalize your client. So he rang me up and I told him, you please tell the judge respectfully to give us a reasoned argument and we will pay the penalty. So we were penalized 50,000 rupees, which we paid, and we got a reasoned argument, the reasoned judgment, why they thought that our argument was wrong. This we took to Supreme Court, but Supreme Court refused to hear it under Article 136 of Indian Constitution. That was a technical denial. Our arguments were never heard by Supreme Court. Issue is not, this is not what I'm trying to come to the point. I was very strongly criticized कि सीपीए का मैटर कोर्ट में मेडिको लीगल एक्शन ग्रुप prematurely ले गया, which is why now IMA cannot do anything about it. I found this very strange. VP Shanta and others judgment आई 95 में. 2019 तक it was 24 years. From 2019, I filed the case in 2022. Another 3 years. तो 3 साल plus 24 साल, 27 साल after doctors had been included within the purview of CPA, I am going to court and I am told by people who could have supported us, who could have helped us with funds, who had much better legal representation, legal teams, and their argument was we have been premature. 27 years waiting is premature. This is our problem. So if somebody is doing something in interest of medical profession, in improving the practice conditions, in improving the training, in improving any particular one issue somebody has taken up, I would strongly recommend everybody to join hands. We don't have any issue. I mean, I have given financial contributions to IMA Haryana when they had to go to court. They were not getting the funds. We gave it from ourselves. But this is what I expect from everybody else. We have a tendency that I know everything, I am the king, and there is no army which can comprise only of kings. There have to be soldiers also who will follow. And the problem with medical profession in our senses, because वो पेशेंट्स हमारे पैर छू के जाते हैं, एमआर हमारे सामने हाथ जोड़ के जाते हैं, हमें लगता है हम खुदा हैं. This is where the fault lies.
Next, Dr. Suman is asking if is passive euthanasia legal in India? If
Yes.
yes, then under which circumstances?
You have to have a primary medical board formed first that will give an opinion. Then a secondary medical board is formed with one member from this district. Once they also give an opinion, ki yes, this is internal incurable, and you have either advance directive or in the absence of advance directive, these two boards have given an opinion on the treating doctor's application. Then, with after counseling the immediate relatives, passive euthanasia is possible. The problem is, uh, Aruna Shanbag was the first case where passive euthanasia was allowed. Aruna Shanbag's case judgment, the Supreme Court laid down certain guidelines on when and how this could be done. Active euthanasia is still a crime in India. But passive euthanasia, they laid down certain procedures which were impossible to follow. So, Critical Care Society of India, they approached the Supreme Court for a review of the Aruna Shanbag judgment. And Supreme Court made the procedure simpler. Finally, in 2023, again, for first, Common Cause Society of India had gone and asked the Supreme Court to make the procedure simpler. Then in 2023, it was the Critical Care Society who said that even this procedure is not serving the purpose. So kindly make it simplified further. They had made it simplified, but Medico's Legal Action Group, we went ahead and under RTI, we asked 6 high courts to provide us with the number of cases of passive euthanasia which have followed the advance directive and have been registered in the high courts as given in the procedure which is laid down in the 2023 judgment. In 6 high courts, only one, Punjab and Haryana High Court, had a single case which advance directive of a person was followed to proceed with passive euthanasia, whereas every hospital, every day, what is happening? Emergency patient is brought. डॉक्टर साहब सब कुछ करिए, जो करना है करिए, पैसे कोई प्रॉब्लम नहीं है, कोई सोचने की जरूरत नहीं है. Once we take the patient in, once the patient is in ICU for second, third day, fourth day onwards, payment becomes an issue. Fifth, sixth day, the relatives will be standing with folded hands कि सर इसको ventilator से निकाल दो, and it is not in your hands to take off the ventilator. So ultimately, what is being done? You say you take the patient lama. Lama means you have left against medical advice. Tube is in place. We give an ambu bag. Ambu bag means that the patient's is being ventilated by the relative. And we also know, the relative also knows, the moment he is outside the gate of the hospital, he will stop the ventilation and the person will be allowed to die. So this is practically what is happening. But what we needed from the courts was a proper procedure, because this is not right. What is happening is not right. But if a proper simplified procedure was given for a problem, we would not be in this situation today. And tomorrow somebody will come and fall foul with the doctor, कि भाई you have deliberately done this or deliberately done that. And we have cases like that.
So before proceeding, I would like to ask you, is it okay if we take a few more questions?
No, I have no issues. You decide.
Okay. So taking the next question from Dr. Yadav. Sir, here in Mumbai, 5 doctors of the government hospital were put in jail for 17 months and Articles 302, 307 were imposed. The case is still going on. This should not happen to our doctor members. If there is such an article, then which doctors will work?
How many doctors are working in Mumbai since 2017? Everybody. Nobody is bothered. The problem is this only, na? If there is an injustice, how do you fight injustice? You have an administrative way, you have a legislative way, and you have a disruptive way. Disruptive way is when you go on strikes. Legislative way is when you approach your MLAs and member parliaments and ask them to do something about it, which is not correct. And administrative way is approaching the various administrative officials from organization side. The question is, for these 5 doctors, how many representations, how many organizations made an effort? Was the member parliament from Mumbai, were they contacted? Were the MLAs contacted? Was a team of 15 doctors had ever gone and approached the senior people? Was a threat of a strike ever given? The problem is, all of us seem to think it is the other end of the boat which is going to sink. I am not on that side. But the problem is, if that side sinks, I will also sink. If not today, tomorrow.
Next, Dr. Krishna Priya is asking, in the application of these laws, is there any difference between government doctors and private practitioners?
No. For Consumer Protection Act, also no. And for criminal law, definitely no.
Next is from Dr. Yamini. Sir, in the last case that you had mentioned, what can be the doctor's defense, extortion and removal of ovary, and it came out to be non-malignant?
कैसे मतलब the point is you have to defend yourself according to whatever is available to you. It depends on the facts of the case. You will show literature. You will. The point is not all that. The point is it is the judicial process. The process when you are asked to come to the police station, where you are made to wait because the inspector sahab has gone for a meeting, or there has been a call over there, and 4 hours you are waiting, sitting on a bench over there. Uh, you know, it's very humiliating. And other doctors find it very matlab, eh, when you say कि भाई, okay, let's five of us go and meet the SSP or the SP, doctors somehow are not as forthcoming as I would expect any other professionals to be. Supposing this kind of a thing would happen with an advocate, I mean, I'll give you an example. In PGI, there was an advocate couple who brought their child after taking the child to two private hospitals. They brought with a foreign body in the bronchus. So the senior resident in emergency told them that we have to do bronchoscopic foreign body removal, and you have to sign the consent. They said, "Ji, what are the complications?" She said, "Even death can occur while doing the procedure." They refused to sign. She mentioned on the card that the relatives have refused to give consent. So whatever else fluids and whatever they were, the treatment was being carried on. 4 5 hours down the line, they must have talked to their relatives, other doctors, whatever. Finally, they said, "Ki, okay, now you go ahead and do it." But in PGI, if you have to organize a procedure, you need anesthetist, you need pediatric surgeon, you need the equipment, you need the technicians. Once when everything has been organized, if you say no and everybody has gone on their different paths, to reorganize it, it takes time. It's not something which will be immediately served to you. In that period, the child died. Now, whose fault was it? Chalo, it may be debatable, but whose fault was it? They did not give consent earlier, but the next day, the entire High Court Bar Council, Bar Association was in PGI. The director was Gheraud. A medical board was formed, and of the medical board, two members of Bar Council were made members. What is the role of Bar Council members in a medical board? I could not understand. But this happened. Why? Because they were members of the bar. This is what I'm trying to say is when doctors do not work together, this is the kind of situation we are placed in. And it is not the other end of the boat which will only sink. When it is going to sink, the entire boat will sink.
Dr. Gautam is asking, is there any difference between 304A IPC and the newer BNS laws?
304A IPC, you could be punished up to 2 years or fine or both. Now, and
So doctors, I think sir got disconnected.
who
Yeah,
got.
yeah.
So now it will be imprisonment of 2 years plus fine. There is no option of only fine. There is no option of The option only is imprisonment plus fine.
Next, Dr. Munawar is asking, can doctors file a case of mental harassment simultaneously while undergoing a trial which they know is irrational?
You have to prove. You have to prove the damage. You have to prove the harassment. You have to prove whatever loss it has caused you. And that cannot happen till the time the trial is ongoing. Your previous trial has to finish. You have to be declared not guilty. And then you have to pursue the case against the opposite party, the complainant. So many doctors have told me ki I will do this, I will do that once the case is over. I have never in my 30 years of experience in dealing with these cases found a single doctor who has fulfilled his promise of going after the complainant who has caused that much harassment.
So we can take the last question. It's another one from Dr. Gautam. Who can prove medical negligence?
Who can prove medical negligence? Uh, I don't know what to say because anybody can allege medical negligence. Any patient can allege medical negligence. Now the question is, are you talking civil medical negligence or criminal medical negligence? If you're talking criminal medical negligence, then that only will be proven by a medical board. A medical board has to give an opinion, and then also the matter will be the charge sheet will be filed, and then also it is only the court which will decide that whether you were actually negligent. Just the medical board's opinion also is not enough. So it will ultimately be the court who will decide that yes, this was a case of medical negligence. So this is criminal. In civil, you have either law under law of torts or under Consumer Protection Act. So it is the commission or the court which will decide. And the way they decide is they can take expert opinions, but it is not mandatory for them, and they do not need to uh, agree with the expert opinions that they have taken. They can take a decision against the expert opinion which they have taken.
So that is it for the questions. Thank you so much for taking the questions from our doctors very patiently. And thank you once again for this wonderful and very enlightening session, sir. I was lovely to learn on this very important topic. It was lovely having you back and really hope to see more of you and more of such sessions on Netflix, sir. Thank you once again, sir.
Thank you.
And doctors, thank you so much for attending the session. Hope you had a great learning time. Before we end, just running a quick poll for our upcoming